And for more on the situation in Texas, where at least 89 hospitals have run out of ICU beds last week, let's go to Dr. Oais Durrani. He's an emergency room physician in Houston. Thank you so much for being with us today, Doctor. Welcome to U News.
Thanks for having me.
Dozens of intensive care units are at or near capacity in your state as the Delta variant continues to spread. What is the greatest need right now? Is it more beds, medical personnel, ventilators, or perhaps all of the above?
Yeah, the unfortunate answer is all of the above. I remember talking to a colleague 2 weeks ago and saying, I don't know if this could get much worse. And unfortunately, over the last 2 weeks, we've, done things in our healthcare system that were unheard of, right? The EMS system in San Antonio, the seventh largest city in the United States, went down for 30 minutes. When we were transferring, one or two patients every week to out-of-state locations, that's now a daily occurrence. Our pediatric hospitals are full. We have a surge of COVID patients in those pediatric hospitals, but we also have a surge of RSV, which is also creating a strain on our system. And then, unfortunately, in critical access hospitals and freestanding emergency departments, which are built to stabilize patients and then transfer them to tertiary care centers in places like Austin or Houston, they're not able to do that. And so those facilities are running low on supplies such as medications, such as oxygen, and we're really in a tough spot right now.
It's really a nightmare out there. Now, let's talk about booster shots. It looks like boosters will likely be recommended for people who received Johnson & Johnson's COVID-19 vaccine. What else do we know about this so far?
Yeah, so once again, we are seeing evidence that these vaccines are extremely safe and effective. We had data that showed that these vaccines were providing a good level of immunity 6 months out. And even though the Pfizer and Moderna vaccines showed a good immune response when you boosted, that wasn't a sure thing when it came to the Johnson vaccine. The reason for that is the Johnson vaccine is built on a different technology. It's not an mRNA vaccine. But with this data today, we now know that getting a boost will give you that long-term protection and immunity to provide protection for yourself, for your family, and for those that you interact with.
We just reported on the dramatic rise in pediatric cases. The U.S. went from 38,000 cases a week near the end of July to 180,000 cases for the week ending August 19th. What steps can parents take to keep school children safe?
Yeah, so I think the answer is simple. We need to be responsible adults. And so that means we need to get vaccinated if you're the parent, if you're the teacher, if you're the adult interacting with those kids. And we need to mask up until we're out of this surge and until we get the community spread of the Delta variant under control. As far as when it comes to kids, if they are eligible for the vaccine, if they're 12 and over, get them that shot. And then get them masked when they go to school. Unfortunately, there's been a lot of debate over mask mandates and whatnot. But as a parent, you can still send your kid to school masked and make sure that they're protected and that your family is healthy.
In terms of masks, now that you mentioned them, what kind of mask will protect kids better at schools?
Yeah, so any double-layered mask would be great. If there's room for a filter in that double-layered cotton mask, I would place a filter in it. With kids, I also like to tell parents that, kids' comfort comes number one. So you want a mask that fits snugly, but at the same time, you don't want a mask that they're going to be fiddling around with all day and taking off, because that's just going to lead to more exposure and negative effects. So something that is comfortable for them, that has no huge gaping holes, but at the same time has two layers and preferably a filter if possible.
Let's also talk about treatments. Texas and Florida are offering monoclonal antibody treatments for people testing positive for COVID infections. Now, how does this treatment work and what is the efficacy?
Yeah, so we've seen that if you're able to get these treatments within that first 7 to 10 day period from when you are symptomatic, there is a 80% reduction in progression to severe disease. It essentially does what the vaccines already do. So if you get a vaccine, it produces an immune response. You develop antibodies, which then fight off any infection that you may develop. These are essentially antibodies that are made in the laboratory that are injected into you to fight off that coronavirus infection that you have at that time. I think they are a great tool in this pandemic, but I don't think they are the end-all be-all answer. We need to continue to make sure that we focus on vaccinations and masking. And then, unfortunately, if you are to get an infection, then we have this kind of backup tool to make sure that you don't get hospitalized and that you make a good recovery.
Thank you so much for your time. Dr. Oais Durrani, emergency medicine physician in Houston, Texas. Thank you for all the work that you're doing and for all this wonderful advice.
Thanks for having me.